This portion of New Day Northwest is sponsored by Primera Blue Cross.
Hey, welcome back to this very special episode of New Day, celebrating Black History Month. And right now, we want to give our respect to the Northwest African American Museum in Seattle.
Yes, also called NAM, and it has this rich tradition of preserving and highlighting the arts, culture, and history of African Americans in the Northwest. Their events and exhibitions include hosting virtual film screenings, and this month featured a discussion with the head of the Smithsonian. NAM is also dedicated to education and outreach.
And in just a few days, they are actually partnering with the Seattle Sounders to bring live music, historical displays, and a giveaway to the February 27th soccer match. And you can celebrate Black History Month with NAM by going to namnw.org.
You know, disparity in healthcare based on race and socioeconomics, it's not a new concern. Strides have been made, but more is definitely needed. According to the Century Foundation, African Americans still experience illness at extremely high rates and have lower life expectancy than other racial and ethnic groups.
Now, while there's no single solution, Dr. Nwando Anyaoku, Chief Health Equity Officer at Swedish, says the whole community's got to be involved.
We talk about how we most of us health systems pride ourselves in delivering high quality care. And we've known to your point, for a long time that different groups, particularly Black populations, do not experience our healthcare system or our healthcare efforts in the same way. And what the pandemic did really was to bring that into stark relief and show in technical a lot of the challenges that created the differences between the way the people experienced care. And so we will look at health outcomes. For example, the African American population may have higher rates of maternal morbidity and mortality, poorer outcomes in childbirth than their Caucasian partners. And the Latinx population might have similar, somewhat in the same direction, but a lot of the differences are most pronounced for the African American population. And the question over the years was, well, why is that? It's not a function of biology, right? It's not because, biologically we're different in any particular way. And it turns out that there's a lot of factors that impact the way that we receive and experience care. A lot of those that happen well before you ever arrive at a healthcare system. So we talk about social determinants of health. And that means nutrition, education, transportation, all those things that affect, can you have good food? Can you get to your appointments on time? Can you take time off of work? And so if you now think about what happened in the pandemic, all of those things came together at one time. So African Americans, if we just stick with that example, were predominantly in systems where they could not take time off work. So there were a lot of frontline workers. There were a lot of people who had to go to work. So grocery store workers, bus drivers, healthcare workers, they had to go to work. So they couldn't isolate. They also were predominantly in families that lived in multi-generational households, which you identified early was a risk for transmission of the virus. And so you start thinking about, comorbid conditions. These African-American populations that disproportionately have poorer control of hypertension, poorer control of diabetes. So it then became a perfect storm, right? Where all of these things combined to make it more difficult for them to experience and receive good care.
So here's a really shocking statistic. Black children are 4 to 6 times as likely to die from asthma than white children. So asthma, a totally treatable disease. And this is just one example of this disparity. So what systems need to change to enable all Washingtonians, young and old, to have equitable access to care?
We need to build a bridge to the community. We need to connect to these groups that we understand, as we now understand that we are not serving, we're not getting the best outcomes in those groups. We've known that, but what are some of the reasons why? So if you think about asthma, for instance, in children, children are subject to who's going to bring them to their appointment. If mom and dad are both working three jobs, can't take time off work, can't get to their appointment on time, then they don't get their prescription filled, right? If they're living in crowded conditions or they're living in multi-generational spaces and they can't find the air quality is challenging, they're subject to the adults in their lives, right? And if the adults in their lives don't have the resources to do the things that those children need, it's challenging. If also the families or the community don't trust the healthcare system, haven't experienced it as being, compassionate and fair to them, well, then they're not likely to go, they might push off going to receive healthcare until it's too late. And so you want to bridge those gaps. You want to get who is trusted in the community. How can we build partnerships, either through the Black church or through trusted community organizations, who can bridge those gaps, who can give education to the families, give them resources? Do they have access to health insurance? Children should, but if the parents don't, or they might not recognize that their children should have that access. So who gives that information and helps them sign up? So in trying to close these gaps in equities, it's important that we understand who we're serving and what their barriers are. And then we start to take apart those barriers piece by piece. People said that healthcare moves at the speed of trust. If you don't trust your healthcare provider, you're not going to ask the questions on time. You're not going to go there until it might be too late. So building that trust and building that connectivity is what is really critical to serve the Black population and make sure that they get the outcomes that we intend as a healthcare system for us.
And you can learn more about health equity and the work Dr. Anyaoku is doing by going to the website you see right there on your screen.